A very dangerous statistic in the field of addiction is a significant increase in the number of female addicts. This is a cause for grave concern, as women have traditionally been the cornerstone of the household, and this statistic bodes badly for the future of our children. Typically, women progress from first use of mind or mood altering substances to dependence far more quickly than men. When women do develop drug dependence, they report problems of greater severity and experience more health-related consequences. The pathways leading to drug addiction differ for men and women. The beginning of female drug-using careers is often related to their relationships with men. Research has also shown that at least 70% of women drug users have been sexually abused by the age of 16. Most of these women had at least one parent who abused alcohol or drugs. For women, the health risks of drug use also go beyond the effects of the drugs themselves. Illicit drug use, such as tick, cocaine or weed, often leads to behaviour that puts women at an increased risk of sexual assault, HIV, hepatitis and other sexually transmitted diseases. Abuse of substances such as stimulants and some prescription and over-the-counter drugs can cause adverse effect on a woman's menstrual cycle, gastrointestinal, cardiac and nervous systems. Female hormone cycles can also cause stronger cravings for drugs at certain times of the monthly cycle. Biology aside, addicted women often have more to juggle than men with similar problems. They're more likely to be bringing up the children and have to navigate the welfare system. Addicted women are more likely than their male counterparts to have been sexually and physically abused. Women are twice as likely as men to suffer from mood disorders such as depression, along with their addiction, which affects their recovery. Addicted women, more than men, face tremendous stigma, which keeps many from getting the help they need. Another major challenge being faced with women and addiction focuses on pregnancy. Substance abuse by pregnant women is associated with numerous complications such as spontaneous abortion, prematurity, low birth weight, fetal abnormalities, neonatal abstinence syndrome, and premature separation of the placenta from the uterine wall. Considerable research on alcohol use in pregnant women points out the significant risk of fetal alcohol syndrome, which involves growth retardation, central nervous system and neurodevelopmental abnormalities, as well as craniofacial abnormalities. Drug use early on in pregnancy can affect the developing organs and limbs of the fetus. Even one episode of drug use during this period can affect the development of a child. Often the result is a birth defect or miscarriage. Drug use later in pregnancy can affect the development of a baby's central nervous system, and after pregnancy, many drugs can pass through breast milk and harm the baby. For her own health and the health of her baby, a woman should avoid using alcohol and all drugs, legal and illegal, unless prescribed by her physician from the time she plans to become pregnant or when she becomes pregnant. Another area where women are vulnerable is in their relationship with prescription drugs. In general, women visit doctors more than men and are more likely to use prescribed medications such as painkillers, sleeping pills, and tranquilizers. Many of these medications, especially pain medication, are short-term solutions to temporary problems. As a result, a medication that was originally prescribed for a temporary anxiety or pain problem and has been used continuously for years can now pose a serious risk for physical addiction. Prescription painkiller overdoses are a growing problem for women, and according to statistics, deaths from prescription painkiller overdose among women have risen sharply. This rise relates closely to increased prescribing of these drugs over the past decade. Some key indicators that may show that a woman may be in trouble with substances are as follows: missing work or skipping childcare responsibilities, drinking in dangerous situations with strangers or dubious friends, their children's behavior changes negatively, being arrested by the law for conduct under the influence of alcohol or drugs, hurting someone while drinking or drugging, becoming emotionally abusive, continuing to drink or drug even with ongoing drug-related tensions with family, friends, workplace, and partners, an increase in the craving for and the compulsion to use drugs. Women develop a higher tolerance and have to consume more to get the same effect. They lose control and the inability to stop once started using alcohol or drugs. They experience withdrawal symptoms after stopping: nausea, sweats, shakes, anxiety. Do you now see that women are becoming more and more prone to addiction? Do you understand the dangers to the family due to this behavior? Do you know someone who may have a problem? Are you prepared to help this person?